One ailment many deeply fear to come down with at this time is COVID-19. They fear the deeply infectious killer virus because medical science is still swinging from one end of research to the other, trying to find perfect solutions to prevention and care. And if you're wondering why that is so, the answer is the virus is a fast mutating one. That means it has the capacity to keep changing from one type to the other, which can make the vaccine used for a previous variant ineffective for a new variant. Medical scientists will then have to return to the laboratory, seeking new scientific interventions to keep people safer. As medical experts try to tackle the associated nerve-wracking challenges to achieving safety, opinions are getting more and more divided on vaccine acceptability. Some are embracing the jabs, while others who are not comfortable with the idea fold their arms, looking away from it.
The first dose, I didn't have any issues, but the second one, I was feeling a bit feverish, headache. Then I was restless, sort of. Then after taking paracetamol, I think I felt better after like 2 days.
I felt no pain, to be sincere. The only thing that I felt at that point in time was that my appetite was increased.
My wife, she had it, she took it about 3 weeks ago, the first dose. She had pain and she was weak.
I have not taken the vaccine because I did not trust the whole process and the government.
I haven't taken the vaccine because really I'm not ready to yet. I'm waiting to see it, that it has been proven that it's safe for everyone to use.
I've not taken COVID-19 vaccine yet, but I believe in it and it's good, but should not be made compulsory by government because we have some other preventive measures by using your face mask, by also making use of the hand wash and many other things like that is enough to prevent COVID-19.
These mixed reactions got me moving further to find answers to several questions people ask about the controversial COVID-19 vaccination. Lagos State Commissioner for Health and another medical expert, Dr. Joella Conde, had to provide answers. This was my first question. Why do people fall ill after taking the jabs?
Yeah, you will fall sick because anything that is foreign to your body will cause you to be unwell. Even ordinary paracetamol. If I show you the side effects of paracetamol, you will never touch it. So anything that is foreign to the body will ultimately elicit or invoke some reactions from the body. There are some very minute number that will allegedly have clots, and some will have some other side effects, myocarditis, but they are very, very tiny, and it's not in the general. We cannot generalize that. This is the issue.
The next question was, why do some people die after taking the second jab? Why is this so?
There is no link per se that this is the vaccine that killed them. Some of these deaths may have been due to cardiac or heart diseases, lung diseases, established lung diseases or illness, chronic diseases that are already there. There's no doubt that vaccines does have some side effects, but there's no evidence from autopsy. The jury is still out as to if they actually died from coronavirus vaccine. The evidence is that it's a casual relationship. There's no concrete link between the two.
We do know that some people, even who are fully vaccinated with 2 doses, will still catch COVID, and some people, very few, but some people will get quite sick, and occasionally some people may die. But certainly the people that are dying who are not vaccinated are much higher than the people who are dying who have been vaccinated.
I also asked both doctors if the vaccine in circulation can be termed completely effective. Had they gone through the clinical trials of stages 1, 2, and 3 and the mandatory watch for side effects? Or are they just microwave quick-time vaccines created by pressure from the pandemic?
It has been thoroughly tested. And for example, for AstraZeneca, I remember that they were testing and at a point they had to stop because somebody died and they had to review it again. So that is what is expected in clinical trials. There will be some side effects, and then that does not necessarily mean that that's will end. So a large population has been tested, and millions, or do I say billions of people have now taken the vaccines, yet the world is safer.
There is no point vaccinating just one part of the world and leaving Africa unvaccinated. What will happen is that we will get new variants in Africa, which will now travel to Europe and America and overcome the vaccines that they have developed over there. We either all move together or we will all experience the consequences of lack of collaboration and partnership.
Lagos State Commissioner for Health, Professor Akin Abayomi, also had to clear the air on whether or not booster jabs may be introduced for added safety, just like some other nations are doing now.
You may require a booster, which is a first, second, and then subsequent doses, because we've also discovered that even though the vaccine stops you from getting seriously sick, it may not necessarily stop you from catching COVID.
And then I asked the biggest question, and the reason why many still do not want to take the COVID-19 vaccine, which is, why will the manufacturers of the vaccines insist they cannot be held responsible for any side effects the jabs may have on anybody?
In this case, the government are saying that if they pass the liabilities to the manufacturers, they will not. They may be sued from now till eternity. So it will drag down on public health, and the government is saying, okay, we'll take responsibility for this. We'll make a law that will give the manufacturers, a soft landing so that they can do their work properly.
Isolated cases may not be enough to make out a case for such significant legal intervention. But if any of these vaccines is shown or reported and proven to have significant negative effects on persons who are infected with COVID, or those who take the vaccine to prevent being infected by COVID, I strongly believe that the pharmaceutical companies should be held liable.
And as I tried to bow out of my investigation, I sought to know if governments and organizations making the vaccine compulsory are on the right track.
The government has a role to protect our own interests. Some people will have COVID-19 and come to work. Some people will take nonchalant attitudes to it. They will infect many. We have evidence all over. So government has to protect the innocent, the vulnerables.
How many centers do we have? How many people who are given the opportunity to even get the vaccine? Because before you say you want to make the vaccine compulsory, you must make the vaccine available.
The federal government has vaccinated at least 1.8% of its population, and Lagos state government has vaccinated 1% with a plan to vaccinate not less than 3% by the end of the year. Wherever the pendulum swings, the watchword remains safety, which must not be undermined at this time. Jacqueline Ogor, TVC News, Lagos.